Hi, I'm Dr. Sean Billings. I wanted to cover some questions we have about acupuncture, and this one is about what to expect when you get acupuncture. There's a couple different type of categories I put them in. One I call anatomical acupuncture, and that's just my own verbiage, but that deals with like musculoskeletal injuries. So if I have a patient here, like on this picture here, and they have tight muscles in the low back, maybe some sciatica symptoms where there's some muscular compression in here. We're actually having the patient lay face down on the table, we expose the area, clean it up, and then we're applying needles into those tight muscles, directly into those quadratus lumborum muscles or the piriformis muscle. And we'll drive that needle down in deep enough so it actually gets that muscle to relax and calm down. Some of the other things we'll do similar to that is if you have some nerve compression, we'll often follow that sciatic nerve coming down to get that nerve to kind of reset, to turn off and wake back up, so you're not getting that pain sensation or that weakness going down that leg. Other places we get a lot of muscle spasms are going to be up here, coming up in the shoulders and here. And those work really well. So that's kind of your anatomical structures. You have tight muscles, trigger points, or nerve compression. So the other side of the coin is that traditional acupuncture where we are trying to balance out those meridians. That therapy looks a little different. It's not necessarily localized in a specific area like we're doing with a muscle injury, because that would be just here or just on the elbow or just on the knee where we have pain in the knee. Where with traditional acupuncture, I'll actually have you laying on the table face up, and most of the points that you're going to know are going to go from the elbows to the fingertips and from the knees to the toes. And as you look at our chart, you can see all these little dots, and these dots correlate with specific areas that we want to treat. So we'll put some in here in the fingers and some in the elbows. And you'll see our chart here. We'll do some auricular acupuncture where we're hitting specific spots in the ear. We'll leave you on the table for about 15 minutes with those needles in, and then we'll take the needles out and get you off the table. Another question I get asked a lot, is there anything on the needles? Well, let me show you these needles. They come in these little tubes here, and they'll pop out, and they have this little plastic head on them, and the needle is just stainless steel. There's nothing on it. You can see it's actually fairly flexible and thin. They don't usually hurt that much because they're not that, I'm not injecting anything into the tissue, but you'll see I'll set it there, tap it in, and that's the needle right there. Sometimes we get it to thread in a little bit deeper. We'll go deeper on gluteal muscles and deep muscles to get down deep, but when we're doing traditional acupuncture, they're very superficial and they're barely going in. That's all we got. If you have any questions, give me a call. Thank you.